If you swallowed a blood pressure pill this morning, I need you to watch this entire video before you take your next one. Not because the medication is wrong for you, but because there are specific things happening inside your body right now, today, that your doctor has never had the time to sit down and explain. And for seniors over 60, not knowing these things is not just inconvenient, it can be genuinely dangerous. Amlodipine, Losartan, Lisinopril, three of the most prescribed blood pressure medications in the entire world. Millions of seniors take one or more of these every single day. Most of them have been taking them for years. And most of them, if I ask them right now what these pills are actually doing inside their body, what side effects to watch for, what foods interact with them, and what warning signs mean the dose is too high, would not be able to answer. That is not their fault. That is a gap in how medication information gets communicated. And today I am closing that gap. I am Dr. Michael Lin, and welcome back to Dr. Michael Lin, Senior Health. By the time this video ends, you will understand your blood pressure medications better than most people ever do. You will know what each one does inside your body, what side effects are common, and what side effects are dangerous, what foods and habits affect how these medications work, and most importantly, what to bring up with your doctor at your very next appointment. Before we start, tell me in the comments which of these three medications you currently take and how long you have been on it. I read every single comment. Now let us get into this. Let me start with something that most seniors are never told, and that makes everything else about these medications make more sense. High blood pressure is not one single problem caused by one single thing. It involves several different systems in your body. Your blood vessels may be too tight and inflexible. Your kidneys may be holding on to too much sodium and fluid. Your hormonal system may be sending signals that keep your vessels constricted even when they should be relaxed. This is why so many seniors end up on more than one blood pressure medication at the same time. It is not because one pill failed. It is because each medication targets a different part of the problem. And Amlodipine, Losartan, and Lisinopril each work through a completely different mechanism. Understanding those mechanisms is not just interesting information, it is practical knowledge that helps you take these medications more safely, recognize problems earlier, and have much more productive conversations with your doctor. So let us go through each one. Amlodipine, what it is, what it does, and what every senior taking it must know. Amlodipine belongs to a class called calcium channel blockers. Here's how to think about it in plain language. The walls of your blood vessels are lined with smooth muscle. That muscle uses calcium to contract and tighten. When those vessel walls tighten, your blood has to push harder to get through, and blood pressure goes up. Amlodipine blocks the calcium channels in those vessel walls. The muscle cannot contract as hard. The vessels relax and widen. Blood flows through with far less resistance. Blood pressure comes down. This is a clean, effective mechanism, and Amlodipine does it reliably. It is taken once a day, which makes it easy to remember. It has a long-lasting effect in the body, so an occasional missed dose does not cause your blood pressure to spike immediately. It does not cause the dry, irritating cough that troubles many people on a different class of blood pressure medication. And it does not cause the fatigue and exercise intolerance that beta blockers commonly produce. For these reasons, Amlodipine is one of the most widely used blood pressure medications in the world, and for many seniors, it works very well over many years. But there are four specific things about Amlodipine that every senior taking it deserves to know clearly, and most are never told. The first is ankle swelling. This is the most common side effect of Amlodipine, and it is one of the most underreported. It happens because when Amlodipine relaxes the blood vessels in your legs, some fluid leaks from those relaxed vessels into the surrounding tissue. By the end of the day, that fluid pools in the ankles and lower legs. Your shoes feel tighter. Your socks leave deeper marks. Your ankles look puffier in the evening than they did in the morning. Here's what frustrates me most about this side effect. I have spoken with patients who had noticeable ankle swelling for months, sometimes for years, and never once connected it to their blood pressure medication. They assumed it was just aging, or they were told to wear compression stockings and elevate their legs without anyone explaining that the swelling was coming directly from the pill they were taking every morning and that there were real options available. The ankle swelling from amlodipine is dose-related. It often improves significantly at a lower dose. Sometimes it resolves completely when the patient is switched to a different type of blood pressure medication. There are also specific medication combinations that effectively counteract the swelling. The point is this: if you have noticeable ankle swelling and you are on amlodipine, do not silently accept it as part of getting older. Bring it to your doctor. It is a medication side effect, and there are options. The second thing to know about amlodipine is flushing and facial warmth, and sometimes mild headaches, particularly when you first start the medication or after a dose increase. These happen because blood vessels near the skin surface are relaxing and widening. For most people, these effects settle down within 2 to 4 weeks as the body adjusts. If they persist and bother you, mention it to your doctor. The third thing is constipation. Calcium channel blockers as a class can slow the movement of the digestive tract. This is not the most talked about side effect of amlodipine, but it is real and it affects a meaningful number of people. If you have been on amlodipine and noticed your digestion has become slower or more difficult, this is worth mentioning. Increased water intake, more fiber in the diet, and regular gentle movement all help, and your doctor should know if it is a persistent problem. The fourth thing, and this is the most important one for safety, amlodipine can cause dizziness when you stand up too quickly. This is called orthostatic hypotension. Here is what happens. Your blood vessels are in a relaxed, widened state because of the medication. When you suddenly move from lying down or sitting to standing, your blood pressure drops briefly before your body can adjust and compensate. That brief drop causes a wave of dizziness or lightheadedness that lasts several seconds. For a healthy person in their 40s, this is a minor inconvenience. For a senior over 60, this is a fall waiting to happen. And falls are not minor events for older adults. A broken hip from a fall can lead to surgery, weeks of rehabilitation, and for many seniors, a permanent loss of independence that changes the entire shape of their life. I want you to understand this not to frighten you, but because the prevention is simple once you know what is causing it. We will come back to the specific steps to prevent this in detail shortly. Now let us go through Losartan. Losartan belongs to a class of medications called angiotensin receptor blockers, or ARBs. To understand what Losartan does, I need to briefly explain one of your body's most important blood pressure control systems. Your kidneys constantly monitor your blood pressure. When pressure drops too low, they release a hormone called renin, which triggers a chain of chemical reactions that ultimately produces a substance called angiotensin II. Angiotensin II does two things. It tightens and constricts your blood vessels, and it tells your kidneys to hold on to sodium and water. Both of those actions raise blood pressure. This system is designed to protect you when your blood pressure genuinely drops too low. But in many people with high blood pressure, this system becomes overactive. It keeps producing angiotensin II and keeping blood pressure elevated even when it should not be. Losartan works by blocking the receptor that angiotensin II attaches to. Think of it as changing the lock so the key no longer fits. The vessels relax, the kidneys release more sodium and fluid, blood pressure comes down. Losartan has specific advantages that make it valuable for seniors. It does not cause the dry, persistent cough that ACE inhibitors, another class of blood pressure medication, commonly produce. It is generally mild in its side effect profile. It does not significantly affect mood, energy, cognitive function, or sexual function the way some other blood pressure medications can. And it has documented protective effects on the kidneys, which is especially important for older adults whose kidneys may have experienced some age-related decline or whose kidneys have been affected by years of high blood pressure or diabetes. But there are 4 things about Losartan that every senior taking it must clearly understand. The first is potassium. Losartan, like all ARBs, can cause potassium levels in the blood to rise. For most patients, this is a small effect that causes no symptoms and no problems. But for seniors who have some degree of kidney decline or who take other medications that also raise potassium or who have diabetes, this effect can become significant over time. High potassium in the blood is not a subtle problem. It affects the electrical system of the heart and can trigger dangerous, irregular heart rhythms. It is also a problem that produces very few warning symptoms until it becomes serious, which is exactly why blood monitoring matters so much. If you have been taking Losartan for more than 6 months and you have not had your potassium or kidney function checked recently, that is a conversation to have with your doctor at your next visit. It is a simple blood test that gives genuinely important information. There are also dietary considerations worth knowing. You do not need to eliminate high potassium foods entirely, but you should be aware that bananas, oranges, potatoes, tomatoes, avocados, beans, leafy greens, and in particular salt substitutes that use potassium chloride instead of sodium chloride can all contribute to higher potassium levels when combined with a medication that is already raising potassium. If your doctor has specifically told you to watch your potassium, please follow that guidance carefully. Salt substitutes are one of the most overlooked sources of potassium and deserve special attention. The second thing to know about Losartan involves kidney function. Losartan affects how the kidneys manage blood flow. For most patients, this is actually protective and beneficial over the long term. But in certain situations, including significant dehydration, severe illness with vomiting or diarrhea, or specific patterns of reduced blood flow to the kidneys, Losartan can occasionally cause kidney function to worsen temporarily. This is why if you ever become significantly ill, with a stomach illness that causes vomiting, diarrhea, or difficulty eating and drinking, you should contact your doctor rather than simply riding it out. In some situations, Losartan needs to be temporarily held during illness to protect the kidneys. Your doctor will guide you on this. Do not make this decision on your own. The third thing about Losartan is dizziness on standing, for the same reason we discussed with Amlodipine. When blood pressure is well controlled by medication, any sudden position change can cause a brief drop that creates dizziness. This is even more relevant when two blood pressure medications are being taken together, as Amlodipine and Losartan often are, because their combined effect on blood pressure is stronger than either one alone. The fourth thing, and this applies specifically to women who can still become pregnant, Losartan and all ARBs must not be used during pregnancy because of serious risks to the developing baby. For most seniors, this is not relevant, but it is important information to pass along to any younger women in your life who may be taking these medications. Now let us talk about Lisinopril. Lisinopril belongs to a class called ACE inhibitors. ACE stands for angiotensin-converting enzyme. Remember that chain of reactions we discussed with Losartan, the one where the kidneys release renin and the body eventually produces angiotensin II? Lisinopril works one step earlier in that chain. Instead of blocking the receptor where angiotensin II attaches, it blocks the enzyme that converts the earlier hormone into angiotensin II in the first place. The end result is similar to Losartan. Blood vessels relax, the kidneys release more fluid, and blood pressure comes down. But the mechanism is slightly different, and so are the specific side effects. Lisinopril has important advantages. Like Losartan, it has documented protective effects on the kidneys, making it a common choice for seniors with diabetes or kidney disease. It has been used and studied extensively for decades and has a very well understood safety profile. It works once daily and is well tolerated by many patients over many years. But Lisinopril has 3 specific things every senior taking it must know. The first is the cough. This is the most famous side effect of Lisinopril and all ACE inhibitors, and it is genuinely one of the most common reasons people need to switch medications. The cough is dry, persistent, tickling, and often worse at night. It is not caused by an allergy or a chest infection. It is caused by a buildup of a substance called bradykinin that ACE inhibitors allow to accumulate in the airway tissue. The cough can develop weeks or even months after starting the medication, which means many people do not immediately connect it to their blood pressure pill. If you have developed a new, persistent dry cough since starting Lisinopril and you cannot explain it by any other cause, tell your doctor. This is one of the most straightforward medication switches in blood pressure management. Switching from Lisinopril to Losartan or another ARB almost always resolves the cough within a few weeks because ARBs do not affect bradykinin in the same way. The second is potassium, for exactly the same reasons we discussed with Losartan. CE inhibitors also raise potassium levels in the blood and carry the same requirement for periodic monitoring of potassium and kidney function through blood tests. The third is a rare but serious reaction called angioedema. This is a sudden swelling of the lips, tongue, throat, or face that can, in rare cases, become severe enough to interfere with breathing. This is not a common side effect, but it is an important one to know about because it can happen at any time during treatment, even in people who have been on Lisinopril for years without any problem. If you ever develop sudden swelling of your face, lips, tongue, or throat while on Lisinopril, this is a medical emergency. Call emergency services immediately. Do not wait and see if it improves. Now, I want to bring all three medications together and talk about the single most important safety issue for seniors taking any of these pills and the one that causes the most real-world harm. That issue is dizziness on standing and the fall risk that comes with it. When you take one blood pressure medication, there is some risk of a brief blood pressure drop when you change position. When you take two, that risk increases. When you take them alongside other medications, or when you are even mildly dehydrated, the risk increases further. And when you are over 60, when your sense of balance is naturally slightly less sharp than it was in your 40s, and your reaction time is slightly slower, the consequences of that dizziness are much more serious. Here's what I want you to do starting tonight. When you wake up in the morning, do not stand up immediately. Sit on the edge of the bed for 30 seconds first. Let your blood pressure adjust to the change in position before you add the challenge of standing. Then stand slowly, keeping one hand on something stable, a bedside table, the headboard, the wall. Wait a few more seconds before you start walking. This single habit, practiced every morning without exception, dramatically reduces the risk of a fall related to blood pressure medication. It costs you less than 1 minute, and it could prevent an injury that costs you months of your life. Also, stay well hydrated throughout the day. Dehydration makes orthostatic dizziness significantly worse because lower blood volume means a more pronounced drop in pressure when you stand. Aim for 6 to 8 glasses of water daily unless your doctor has told you to restrict fluids for another medical reason. Be careful with hot showers and hot baths. Heat causes blood vessels to dilate, which compounds the effect of the medication. Sitting on the edge of the tub or shower seat for a moment before standing is a small habit worth building. Be aware that alcohol can cause more pronounced drops in blood pressure when combined with these medications. If you drink, do so in strict moderation and be especially careful with position changes afterward. And if you experience significant dizziness on standing, near falls, or an actual fall, report this to your doctor immediately. This is not something to minimize or explain away. It is a signal that your medication dose or timing may need adjustment, and that is a completely manageable conversation. Here's the simple action plan I want you to walk away with today. Check your ankles. If you are on Amlodipine and you have noticed swelling that has been there for weeks or months, put it on your list to discuss at your next appointment. Check your last blood test. If you are on Losartan or Lisinopril and you do not remember having your potassium or kidney function checked in the last 6 months, ask your doctor for updated blood work. Check your salt substitute. If you use a potassium-based salt substitute and you are on Losartan or Lisinopril, mention this to your doctor or pharmacist because the combination can push potassium higher than either one alone. Practice the morning stand. Starting tonight, commit to sitting on the edge of your bed for 30 seconds every single morning before you stand. This habit alone may be the most protective thing you take from this video. Watch for the cough. If you are on Lisinopril and you have a persistent dry cough that you have been ignoring or attributing to something else, bring it up. There is a straightforward solution. Bring your full medication list to every appointment. Both amlodipine and losartan and lisinopril interact with various other medications, including some common over-the-counter pain relievers and certain supplements. Your pharmacist and doctor need to see the complete picture every time something new is added. I want to hear from you now. Which of these medications are you taking? And has anything in this video explained something you have been experiencing but never connected to your blood pressure pill? Tell me in the comments below. Your answer very likely reflects what someone else in this community is experiencing right now, but has not yet put into words. Remember, this video is for educational and informational purposes only, and is not intended to diagnose, treat, cure, or prevent any disease. Please never stop or change your blood pressure medication without speaking to your doctor first. Stopping blood pressure medication suddenly can cause serious harm. Always work with your healthcare provider. If you found this video helpful, don't forget to subscribe to Dr. Michael Lynn's Senior Health and hit the notification bell so you never miss a health tip. I'll see you in the next video.